Hello, good evening, and welcome to USMLE. That's the topic for today. Say, this is what we are doing every week, meeting on Wednesday, Saturday, Sunday, Wednesday and Saturday at 8 p.m. and on Sunday it is in the morning at 11 a.m. Right. Over here, this Wednesday we talked about National Exit Test and PLAB. And today we'll be talking about one of the finest exam in medical science, and that is the USMLE, right? Sunday, this is the day which is specially for parents. And tomorrow we shall be talking about that what are the responsibilities of parent and what are the doubts usually they have about whether their kid should be going into medical college which is of government or private medical college or should go abroad. All those questions they will be answered tomorrow at 11 a.m. Okay. One very important announcement regarding the national exit test. There is still a confusion, but declaration for 2023 that has not been made. So 2024 definitely it would start. But what I mean to say is that if you have taken the admission now, that is means you are into first MBBS. So definitely you will be the candidate who will be appearing for national exit exam after completion of your third MBBS, right? Third year of MBBS. That is final MBBS. So regarding this 2023 or 2024, well, it would definitely be coming up into 2024 batch, right? So this was one of the important announcement. Otherwise, rules and the pattern, everything remains the same, what we discussed on Wednesday. Okay, on to USMLE. By the way, I'm Dr. Bankim Jani and I am a radiologist. After doing my MBBS, DMRE, went for MRI. That was my dissertation. Then into the field of information technology and acquired 23 international accreditations in IT and over 118 medals into the field of sports, that is marathons, ultra marathons, and more, right? Some trail marathons, etc. Marathon, by the way, it is 42.195 kilometers, right? And then there is a time within which you have to finish that race. That is what is called as the cutoff time. Trained thousands of students, almost 25 plus years of training experience, and more as we talk. Okay, so USMLE, which is the United States Medical, that's the word, licensing examination, right? This is the licensing examination. That means if you want to practice in USA or Canada, you have to appear for this particular test and you have to clear it. Exactly the same way when we said that if you want to practice in India, so you have to go for national exit test. You want to practice in UK, you have to go for PLAB, right? So these are the things. But when you talk about USMLE, USMLE will give you many advantages, many cutting edge advantages. This is the exam which is for everyone. What I mean to say is, whether you have done your MBBS from India or from anywhere in the world except USA and Canada, right? Except USA or Canada, because if you are in USA or Canada, then it is not for you. This is the rules will be completely different. Right? So whether MBBS done from India or Georgia or Kazakhstan or Kyrgyzstan or Turkey or Russia, it really doesn't matter. Everywhere, right? This is the exam that is USMLE will come into picture. Let's make it simple. USMLE is divided into 3 steps, right? 3 steps. This is step 1, the first step. Step 2, but we'll be telling it specially in the form of CK, clinical knowledge. Previously, there was clinical skills that was called as the step 2 CS. But now that step 2 CS is part of the step 3. This step 3 you will be giving when you will be going to USA, because this is the exam which is conducted over there only, right? So we need to focus first on these 2 exams. Let's focus more. Step 1, when to give 1-word answer after second MBBS. Or so then you might ask that national exit test, so you are appearing after completion of your MBBS, right? Because this exam USMLE is multi-step. So that's why make your mind right from the beginning that you want to appear for this exam. Now, because this exam is MCQ, multiple choice questions, but it is not like single liner. There might be multiple tabs. You'll be given more details, and then you have to come up to a conclusion. So when you are preparing for USMLE, automatically you will be shining in your college exams, right? Because here the exam standards, they will be bit tough. But well, it's so rewarding. Seriously, it's so rewarding. Whether you consider from the respect wise or you consider from money wise, no doubt about it, right? So let's see more about it. So this is clear that USMLE is for everyone, because say in next we said that those students who have passed from India and those who are IMG. IMG is International Medical Graduate. So if you have passed MBBS from anywhere except India, then you are an IMG with respect to India. But now this entire thing is with respect to USA. So with respect to USA, even Indian students, they will be called as IMG, because they are like international students, medical graduates from other than USA. Correct? Okay. On to step 1 in more detail. So let's take a new page. Here it is. Step 1. Is it important? Right? You said that it can be given after second MBBS. Yes, after second MBBS. So there has to be a reason behind it. The subjects which will be included into the step 1 exam, they will be like anatomy. Bindas, that is the first year subject. Physiology, surely a first year subject, right? Biochemistry, a first year subject. I'll be telling you slightly more about some of the examination patterns and the way things are taught, because I felt like that every student should know about it, right? Don't take me wrong that your university or your college or any of your teacher is teaching in different pattern. Don't worry about it. But if you follow the pattern which I'm about to tell you, it will help you a lot. Help you a lot. Recently, I came across few syllabus, right? The way it was taught. And it was a bit of surprise when the upper limb was taught and then there was skull also. Now, skull is part of head and neck. When you are absolutely new, what you can do is, irrespective of whether whatever is taught in the college, finish upper limb completely. Finish upper limb completely. Trust me, it is plane, right? It is like a plane. It is a level. One by one, you keep on removing the layer. There is something like anterior. There is something like posterior. Easy to understand. Once you understand upper limb, it would be very easy to understand lower limb, right? Then you'll be the reference that how things are arranged, it will start becoming more and more clear. Skull, and that also for the first semester, right? For the first semester, I if you go to our YouTube channel, because last year we conducted in association with VMAP. VMAP is Vishwa Medical Admission Point, right? The number is over here, so you can contact, and you can even send questions on that. So we conducted several training sessions, and in one of the training session, when I was teaching head and neck, that is where the skull came into picture, and we went in full on detail with skull, with every piece, every bone. But the point is, skull is a three-dimensional structure, right? So the concept becomes more and more clear as you learn more and more bones. So the order upper limb, then lower limb, and then you go for say, thorax, right? You go for abdomen, and then when you go for head and neck, then it makes a big difference, because things will start fitting in your brain very properly, right? So just a suggestion. The question are for the step one are from anatomy, physiology, biochemistry, behavioral science. Behavioral science, right? This is interesting. Behavioral science, that is sort of psychology, and communication skills. Communication skills. You don't have to appear for IELTS, but yes, your communication skills, they will be evaluated. And then comes the pathology. That's why I said that you need to appear in this exam after your second MBBS, because pathology, and not only patho, it is a pharmac also, pharmacology. Now these two subjects, they comprise of about 45 to 50% of your entire paper. So it definitely makes sense, right, that you appear for your first step of USMLE when these things you have learned, that is anatomy, physiology, biochem, behavioral science, communication, patho, and pharmac, things would be much clear in your mind, and you'll be much more comfortable, right? So this is what is asked. Now the exam pattern, this is worth understanding. For your success, it is very much important. In USMLE, everything will revolve around the concept of block, right? Block. This is a 60 minutes block or 1 hour block. 1 hour block. Now, in these 60 minutes, you have to appear for 40 questions. This is 40 questions per block. So it is not so that, let's say, in first hour you have done 36 questions, and in second hour you can go for 44. No backlogs, right? Once the block is over, that block is finished. Move on to the next block. That's the pattern. That's the pattern. So in exam, there would be 7 blocks. No confusion. Now, carefully watch what exactly the step 1 is. 7 blocks, 40 questions each. Right. So this will come to what? 7 4 is 28. So 280 questions. 280 questions they will be asked. 7 blocks. Exam is of 8 hours. That 1 hour is a break. It's a break, right? That can be taken. In case if you finish any of the block earlier, so then you can take that break, that you can utilize that time as a break. So 7 blocks, 40 questions each, one after the another blocks will start appearing, and you have to keep on answering. Total 8 hours, in between 1 hour of break. I'm just right now telling you that how the exam is. After that, we'll be going into the detail of registration. We'll also be watching how much is the cost, where exactly you have to register yourself, which is one-time registration, how to check your college, whether it is appearing in WDOMS, right? I'll show you. So this is step 2CK. 2CK is clinical knowledge. So obviously the type of questions are going to change. Here, what would be asked? All systems. Everything can be asked. All systems. So emphasis will be on diagnosis plus initial treatment. Initial treatment. This will be the focus, right? There would be many questions on legal and ethical issues. So there is a book, you have to really read it very properly. And patient safety. This is of prime importance. This is of prime importance. So that's how step 2CK goes. So over here also 60-minute block, and number of questions which will be asked into this would be 40 questions. Per block, 40 questions. So total 8 blocks. Total 8 blocks. By this mathematical calculation, 8 4s are 32. So there has to be, say, 320 questions in the entire paper. Well, you are almost right. Almost right. This number is in fact 318. Right. This is 318. Here also 1 hour break is allowed. 1 hour break is allowed. So this is the pattern, total 318 questions to be answered. And as I said, these are MCQs, but not necessarily they are single line question. No, sometimes the question would be descriptive, answer would be short, just to select the choice A, B, C, D. Right. Okay, so this is step 2CK. Both these exams, they can be given in India. Right? They can be given in India. Now comes the final exam, and this one is step 3. And this can be given in USA only. Right. What will they be checking? They'll be checking that, are you ready? Right? Are you ready for unsupervised? No one is watching you. Unsupervised practice. Right. This is the prime motto. That is unsupervised practice. Very fond of blocks. Right. So it is divided into 2 parts. 6 into 60 minutes block. Right. As we said, block is of 1 hour. How many questions? 38 to 40 questions would be asked. The second part, right? One was unsupervised. The second part was computer-based. Right? This would be called as the computer-based case scenario. Computer-based case scenario. Computer will generate the scenario. So over here, there are 9 hours exam. Over here, there was like 8 hours examination. Right. But over here, this is 9 hours. Right. In 9 hours, over here, this is what? This is 7 hours. 7 hours, 1 hour break. The second part is 9 hours. Here, 30 questions. 30 questions per block. Total 6 blocks. So this means 180 questions. 180 questions. This is what would be asked. Plus, you'll be asked 13 cases. And you are given about 10 to 20 minutes per case. Right? Per case, not per day, per case. That's what is. Right? So you must have noticed that this is step 3 is a bit tricky, right? Step 3 is a bit tricky. And that's how you get the USMLE degree. Now this USMLE is valid in Australia. And when I say UK, so then people say, there was PLAB for it. Well, PLAB also and USMLE also, both are valid, right, for the UK. Then UAE, right? Then Dubai Health City, right, which is also called as Dubai, but it's named DHC, Dubai Health City. Then very Israel, right, Ireland, New Zealand. These are some very common. Then Qatar, India. Yes, if you clear USMLE, you don't have to appear next, because that USMLE is allows you to practice in India. Right? So this is how it is valid across so many countries. Let's come to know about one ECFMG, Education Commission for Foreign Medical Graduates. Right? This is the special education commission for foreign medical graduates. Now, if you really are serious and you say that, yes, I want to go for USMLE, so then USMLE is where you have to apply. You have to apply. To whom? This is where it would come, that is, you'll be requiring your certificate of identity, right? Now, say if someone is USA or Canada, see how things are different. There also, they have to apply, but that they will be applying to National Board of Medical, NBME, right? Volume is less. Just a minute. Sure. Is it okay now? Should be better. Anyway, now is the crucial part, right? So USMLE, to apply, if someone is in USA or Canada, so then there is National Board of Medical Exams. We don't have to do anything with that, right? We are IMG, International Medical Graduates, right? So for rest of the world, बाकी की पूरी दुनिया के लिए, for rest of the world, first thing which you'll be requiring is, from ECFMG, you need to know, you need to get your identification or the permanent number. That is needed. Right? So what is that? ECFMG tells that, okay, you are a valid student, right? Valid medical graduate, or you are a student from a university or a college which is into WDOMS. So this is what is called as the Form 186. Form 186. This is certificate of identity. Identity. That means it is where you will be identified. Yes. And this is to be done only once, and it is permanent for whole life. Permanent for whole life. Online, right? This is to be filled, the form is to be filled online at ecfmg.org, right? It is org. You have to pay. This is not free. You have to pay $160. That's the charge for this Form 186, which will give you the certification of identity. Up number. It will give you a number. This number is permanent. Right. So that is our first, that is a Form 186. Right. USMLE is so fancy. So is anyone interested? Let's say at late age, if someone decides, okay, I want to go for this USMLE, can he? Yes, definitely. Any age limit? Nope. No age limit. No age limit. Just this much to be confirmed, that you are officially enrolled or graduated. But graduated from whom? From where? Well, from a medical school. Any medical school? No, not any. This particular college should be appearing into wdoms.org, and your college should be seen over here, and that's how the college will be getting its FAMER number. FAMER School ID. Once this number is obtained, right, that number will remain with you for whole life. This is the number. This is something which is your identity, right? IELTS or test of English as foreign language, TOEFL, no, you don't have to appear for it. Not needed. Right? Let's see this thing a bit practically. So it is wdoms.org. I'll just drag this thing on our screen. We can see it. So here it is, World Directory of Medical Schools, and you have to just click over here, search the World Directory. Done. Then let's select country. Say I would like to figure out whether my college is over there or not. So this is India, and city. Yeah, this is Ahmedabad. Operational, definitely operational. Yes. Medical school name. Even if you don't click it, you just go for search. See, it is showing all the medical colleges in Ahmedabad. Right, the top, this is PJ Medical College, Ahmedabad. Yes, that's my college. So I'll just click on it. As I click on it, it shows that it is a very old college, established in 1946. Operational status, definitely currently operational, all good. But what we are getting over here is the number. That's the FAMER number, right? This is the FAMER number. And that number we have to say select, or that number is what we have to use when applying for the form. So here is the number. So that's how you get a FAMER number, because when you opened up your college details, this was the site. Right? This is the place where you'll be getting the FAMER school ID. Now, here is, you have worked hard and you want to appear for step 1. So you have to schedule it, right? You have to scheduling the exam. In this exam, when you say, I want to appear on this date, the examination fees is $985. Yeah. Plus, there is plus and that is international, because we are Indian, but for US we are international medical graduates. So this is international test delivery surcharge, right? This is surcharge, the extra which we are paying. That is once again $185, right? $185. So that total comes to $1170. Huge one. No, there is 3 months eligibility. Right? 3 years. This you appear for this exam, it is valid for 3 years. In case of any problem, and if someone's go for rescheduling, so that rescheduling will cost $604. Change of date, right? Change of date. So that's how it is arranged, right? Now, before July 2021, there was a big difference which came into limelight after July 2021. So before that, what was the situation? July, say 20. So at that point, 4 attempts were allowed. 4 attempts per step. Right? This is if before this July 20. So if anyone fumbles, they were given 6 attempts, right? 6 attempts per step. But now it's 4 attempts. 4 attempts per step. But when we prepare properly, nothing to worry. These 4 steps, there is a pattern. That is 3 attempts. 3 attempts in 12 months. But then if someone wants to appear for the 4th time, so then there is gap of 1 year or 12 months. 12 months. And then one can go for 4th attempt. Right? So 3 attempts, they can be given in the span of 12 months, but then comes the 4th exam, so then it has to be given just after 12 months of completion of last exam. Right? If pass, so then great. But what if someone gets a retake? Right? A retake. So this is not easy. Right? Your results would be displayed on screen, right? So whether someone has passed or not, all those details, they will be appearing on the screen on the website for 1 year. On the website for 1 year. If you want transcript, a paper where every detail is mentioned about the score, about whether how many attempts, every detail. So that is called as the transcript. That transcript is needed. If you are requiring it by yourself, so then it is called as the individual requirement. Individual requirement. So remember, transcript is like your score sheet, right? Everything is mentioned. And sometimes institution, they ask for this form. So that is form 173. This is for institutional requirement. This is the institutional requirement. They say we want form number 173, right? In either case, it costs $70. No fax, right? They won't reply. No emails, right? All those things they are not allowed. So if you send mail to them or you fax them, they won't respond, right? This is the method. Fill the form 172 along with the payment and you'll get the reply. Similarly, there is provision for score recheck. Score recheck. Never go for it. Never go for it. Because they themselves say that we'll be checking this thing manually. Right? They won't check. They won't check each and every question. It is just the score is okay or not. So here it is like that result has, once the result is declared, results have not changed. So even if you pay, right, even if you pay, right, there won't be any change in the result. And this you have to do within 90 days. And this is what is called as the form 265. This is the form 265, right? And this thing will cost you $80. It's crystal clear that this is how things would be asked for. So in step 1, now if you calculate in step 1 and step 2, $1170 for both the cases, $1,170, that is which is charged from you. $985, that is the basic cost, right? And $185, this is the total, right? One more step, verification. Say this is done by state medical licensing authority. Whosoever wants that, yes, you come and practice with us. So this is again by medical authorities. This proves that you are genuine. And this is at the cost of $66. Right? This is the verification form. So you have to pay for it. Now, as we said about the step 3, right? Step 3. Step 3 in USA or Canada. Two parts. One, way back, right? Way back in 2020 or 21, it was $895. $895 was the charge, right? Way back, 2021. Now, they have raised it to $915, right? And that's it. This is what is to be done. Now you said that you might say that this step 3 is to be given in USA or Canada. True. So in that case, you'll be requiring visa. Yes. Make very clear. Either you're going on student visa. So this is F1 student. Right? F1 visa. Or you can go for, but this is a bit difficult, J1. This is for that exchange visitor visa, right? This is called as the exchange visitor visa. or the best, if you really want to practice even at that point, so you go for H1B. But nowadays, this is pretty difficult, right? The paperwork itself is so high. So best is either student visa or this J1. They both are good for this purpose. So this is what USMLE is. I would just say that USMLE, it is very much interested in your foundation. Then it rises. So USMLE is where it will be talking about foundations. So that's how the whole pattern of USMLE is planned, right? So we just revise it first. One, you'll be requiring your that certification of identity, right? Which is fixed number. Then you will go to say wdoms.org and look for the college, right? It should appear over here. So that is wdoms.org, and then start the training. And as person approaches, right, by the end of second year, when he has completed anatomy, physiology, biochemistry, then pathology, pharmacology, the subjects which are holding almost 45%. So by the end of second year, yes, you can appear. And then the exam pattern. This is the exam pattern. Anything crammed is of no use, because this exam will be focusing on your diagnostic skills and the initial treatment skills, right? So this is what was for USMLE. Tomorrow in the morning at 11 a.m. we'll definitely meet, right, for something which is very important, especially for the parents, right? Though we'll be addressing the entire crowd, parents as well as students, but very important for the parents. Okay, so thanks a lot. And if you got any query, just let me know. You can say even right now also, else you can send the query at this number and we'll cover it up tomorrow or day after, whenever we meet, right? So thank you and see you soon. Bye-bye.